Okay, everyone wait. Okay. Okay. Well, this is my narrative speech. Okay. It was the day that I knew my life had changed forever, the day that I had to officially watch what I eat and watch my symptoms so that my health can maintain a smooth ride. Some skeptics may say that it is something that is all in your head and that it is not really a known disease, but in reality it is a disease that can potentially cause many problems throughout your body if you do not take proper care of it and go on a strict diet to prevent terrible health issues in the future. This disease is known as celiac disease, and it truly has changed my life forever. It was the night of August in 2009. I ate a regular dinner with my mom made for me, and later that night I was sitting in the recliner where I had a serious abdomen attack, where I was in so much pain that I could not move with that attack. So that led me to go to the emergency room. In the emergency room, the doctor listened to what symptoms I had and decided to check my stomach through an ultrasound. The doctor found nothing wrong with my gallbladder or any vital organs that could be seen and nothing seen out of the ordinary. With nausea medicine and medicine to numb my stomach, I could still feel this pain that I felt like I was getting punched in the stomach over and over again. The doctor insisted that we go ahead and just take my gallbladder out since there was nothing there, but my mother insisted that that could not happen. A week later, I was scheduled to get these tests done. I went to the hospital to get an endoscopy done and also a biopsy of my stomach and esophagus. They did all sorts of tests on the biopsy that was stomach related and could cause any severe discomfort. A few days later, I then had vitals of my blood drawn to get the same test done on my blood. With all those tests, there was only one outcome that came out positive for both, and that was celiac disease. This disease was known to be genetically prone, but I have no family members who have this disease. So the doctor just explained that it was my organs reacting to the food that I was eating. So from then on, I went on a strictly gluten-free diet, eliminating wheat, rye, and barley. Celiac disease is a disease in which a small intestine is hypersensitive to gluten and leads to difficulty in digesting food. It is an autoimmune disorder that can occur in genetically predisposed people where the intake of gluten leads to damage in the small intestine, and if not treated properly, there could be damage in the liver and stomach. It can affect 1 in 100 people worldwide. 2.5 million Americans are undiagnosed and are at risk for long-term health complications if not diagnosed or following the strict diet where you have to eliminate wheat, rye, and barley. This is fairly difficult for me because I love bread and pasta and occasionally cakes and cookies. It is a huge lifestyle change for me. When someone eats gluten, their body mounts an immune response that attacks the small intestine. This can lead to damage in the villi, which are small finger-like projections that line the intestine where that can promote nutrient absorption. When someone eats gluten, a reaction happens when the villi gets flattened out and destroyed and cannot have vital nutrition that your body needs. The symptoms of celiac disease are what really got me to know that I do have celiac, and that caused me to get the initial test done. Digestive symptoms are more common in infants and children, which makes it easier for a doctor to tell if they could have celiac disease. The symptoms from the Celiac Disease Foundation include abdominal bloating and pain, chronic diarrhea, vomiting, constipation, pale, foul-smelling, or fatty stool, weight loss, fatigue, irritability, and behavioral issues, dental enamel defects of teeth, delayed growth and puberty, short stature, failure to thrive, and ADHD. With adults, they are not as common to have digestive symptoms like kids, and only 1/3 experience the diarrhea. The symptoms for adults from the Celiac Foundation include unexplained iron deficiency anemia, fatigue, bone or joint pain, arthritis, bone loss or osteoporosis, depression, or anxiety, tingling, numbness in the hands and feet, seizures or migraines, missed menstrual cycles, infertility or recurrent miscarriage, canker sores inside the mouth, and an itchy skin rash. There's one thing that does scare me about this disease, and that would be the long-term effects. Knowing that if I do not strictly go by my diet, then serious problems can occur in my health. It can develop at any age after people start eating foods or medicines that contain gluten. If it is left untreated or undiscovered, it can lead to serious health problems like type 1 diabetes, multiple sclerosis, anemia, infertility, and miscarriage, migraine, short structure, and intestinal cancers. It can also have damage on the liver and stomach, and there are strictly no medical treatments for this other to go on a strict gluten-free diet. I now have to look at the labels on every food to see what exactly is in each product. It is easier now to read food labels than I was when I was first diagnosed because products actually are putting gluten-free on them, so it is easier to detect if it has gluten or not. I have a lot of luck shopping for groceries at Hy-Vee, Whole Foods, and Trader Joe's to find great food products that are gluten-free. This disease has truly changed my way of living, definitely for the better. I am thankful for having the opportunity and technology to find out that I have celiac disease, and it has changed my life forever. So everyone, wave back to the camera. Okay.